not realize just how important hearing is until it affects someone we love or even ourselves. Joining us today for Better Hearing Month is Dr. Hunter Gerhart with Livingston Hearing Aid Center to talk more about the impact of hearing loss. Thanks for being with us about this really important topic. So my first question is really, when does hearing loss begin, or is that like it runs the gamut?
So hearing loss can begin really at any age. You know, if it is something that is a genetic component, that's likely going to appear first in childhood. But, you know, as we get older and have more and more birthdays, hearing loss is more common. So, you know, hearing loss is something that affects people of all ages.
Okay. It's not just like, well, somebody past a certain age, 60, 70 or whatever.
Right.
Okay. And what are some of the first signs, I guess, of hearing loss that people might overlook?
You know, a lot of times I hear from my patients that sounds seem muffled,
Yes.
Speech seems far away, but really the most common thing that I hear is that people tell me I can hear, but I can't understand what people are saying. And so if you or anyone you know is experiencing any of those symptoms or even ringing in the ear, it's really important to get your hearing checked by a hearing healthcare professional.
Right. Let's talk about it, because you're talking about that's tinnitus, correct? A lot
Correct.
of people have tinnitus. How do you know if it's one of those things where, okay, it's going to go away in about 5 minutes, but if it keeps going, what do you do?
Right. If it keeps going, if it is persistent and still there, it's time to get your hearing checked.
Okay. And are there certain age groups that are more at risk? You talked a little bit about genetics, so they're more like different age groups that are more at risk for this.
Well, you know, there are risks of hearing loss in general. One of the most important risk, in my opinion, is the risk of dementia. Hearing loss is the only modifiable risk factor for dementia, and so it's really important that we stay on top of our hearing health and, treat that hearing loss as soon as possible so that it doesn't lead to dementia and cognitive decline.
I was going to ask you too, how does hearing loss, how does it affect other parts of our health?
Yeah, it's a great question. You know, dementia, like I said, is the most prominent, and it is the only modifiable risk factor for dementia and cognitive decline, but there are other risks as well, like increased fall risk and cardiovascular disease when an untreated hearing loss is present.
Wow. And how do you know when it's time to really consider hearing aids or other treatment options? That would be something, if I were to get to that point, I would push off as long as I could. I don't want to take that step. What do you tell people who don't want to take that step?
You are not alone. Most people feel that way, and most people, it takes about 7 years from the time that they first start noticing difficulties to when they actually get treatment. And with hearing aids, the sooner we can treat the hearing loss, the better the outcomes. And, there's still a lot of misconceptions around hearing aids. I think that people think that, oh, just because I'm wearing hearing aids, it's going to make me look older, but that couldn't be further from the truth. We have, children wearing hearing aids, and, hearing aids are a great tool for anyone with a hearing loss of any age.
And the technology is so great. I mean, you can get hearing aids that you don't even see them, right?
Absolutely. There are invisible hearing aids. There are Bluetooth compatible hearing aids where you can hear phone calls and GPS directions right in your ear without anyone else hearing it. And so the technology in hearing devices have just come a long way in recent years.
And just like everything else, we have, yearly checkups for, dental health, eye health. Do we need to do hearing as well, or just when, I went last year because I had an issue in this ear, but I don't get my hearing checked?
You should. Everyone should get their hearing checked every year, just like we go to, like you said, going to the eye doctor, the dentist. It's important that we also stay on top of our hearing health.
All right. Some great advice. Thank you so much for being with us. Appreciate it.
Thank you for having me.
All right.